Which acid-base imbalance is seen in prolonged vomiting? Correct option is C. In chronic renal failure, which hormone deficiency mainly causes anemia? Correct option is B. Which valve is affected in rheumatic heart disease most commonly? Correct option is D. Which laboratory finding confirm nephrotic syndrome? Correct option is C. Which drug reduce preload in heart failure? Correct option is B. Which part of the brain regulate body temperature? Correct option is C. Which electrolyte imbalance is expected with prolonged diarrhea? Correct option is B. Which insulin has the fastest onset of action? Correct option is D. Which hormone is responsible for uterine contraction during labor? Correct option is C. Which artery is most commonly involved in inferior wall myocardial infarction? Correct option is C. Which sign is characteristic of increased intracranial pressure? Correct option is D. Which vitamin deficiency causes megaloblastic anemia? Correct option is C. Which condition is an absolute contraindication for thrombolytic therapy? Correct option is A. Which hormone antagonizes insulin action? Correct option is A. Which organism is the most common cause of urinary tract infection? Correct option is C. Which finding differentiate asthma from coronary obstructive pulmonary disease? Correct option is C. Which drug is used as an antidote for organophosphate poisoning? Correct option is B. Which hormone is secreted by the posterior pituitary gland? Correct option is C. Which electrolyte imbalance causes muscle twitching and seizure? Correct option is B. Which condition causes barrel-shaped chest? Correct option is C. Which lab value is most important before administering heparin? Correct option is B. Which nerve damage lead to foot drop? Correct option is C. Which acid is decreased in metabolic acidosis? Correct option is C. Which vaccine is contraindicated in pregnancy? Correct option is C. Which artery is palpated during CPR in adult? Correct option is C. Which hormone maintain basal metabolic rate? Correct option is C. Which disease is caused by lack of surfactant in newborn? Correct option is B. Which electrolyte imbalance causes ECG in UVs? Correct option is B. Which drug is preferred for acute pulmonary edema? Correct option is B. Which nerve is tested by asking the patient to shrug shoulder? Correct option is B. Which type of shock show warm flush skin initially? Correct option is C. Which hormone increase renal reabsorption of water? Correct option is B. Which condition causes hyperpigmentation of skin? Correct option is B. Which electrolyte imbalance can cause laryngeal spasms? Correct option is B. Which structure is affected first in glaucoma? Correct option is C. Which vitamin is essential for collagen synthesis? Correct option is B. Which condition is characterized by polycythemia? Correct option is A. Which drug class is contraindicated in asthma? Correct option is B. Which lab finding is seen in acute pancreatitis? Correct option is B. Which condition present with positive chronic sign? Correct option is C.